because if you're a student and you're about to test for your boards, this section is critical. Are you interested in the clinical practice guidelines for nurse practitioners by Fenstermacher and Hudson? So I was asked to do a review on this clinical practice guidelines for nurse practitioners. If you are interested, stay tuned. Welcome back to my channel. It's Jamesia Capri, the nurse practitioner extraordinaire. And if you're new to my channel, I am a full-time family nurse practitioner working in primary care. I do kind of specialize in women's health and menopausal health and things like that. On this channel, I talk about nurse practitioner students. I talk about preceptorship. I also talk about feminine health, women's health, any type of medical treatments or things that I feel like you can manage at home by yourself. So today though, I am doing a review of the practice guidelines for nurse practitioners. This is the book. And I was asked by a viewer to do this review. And I have had some time to spend with this clinical practice guidelines and use it in my practice, and I do like it. The only thing is I feel like it, anyway, let's just go right into it. Okay, so I decided to, for this review, I decided to just look at, you know, hypertension, something that we would see pretty frequently in the primary care setting. And you know, you might see it as a new workup, you might see it as a chronic illness, somebody you've been following, and you kind of want to look up the guidelines. So I'm going to dig into it for you. So when I first, what I want to say, first let's look at the size. The size is decent, okay? This is a book that you can put in your pocket. It will be a little bit heavy, but not, it would be a little bit heavy, but you can put it in your pocket if you kind of, you know, finagle it a little bit, okay? I may go get my jacket so you can see it before we're done, how it looks inside of your pocket. Now, the writing, to me, is a tiny bit small for me, just because, y'all, I can't see that well anymore. I used to be able to see, I just ended up getting old. But anyway, so I have to use my readers, but even with my readers, it's just a little bit small. So that's pretty much it with that. Now, as far as usability, I found it to be really, really good for what it is for, meaning for clinical practice guidelines, it is very good and it does go into detail. So I want to talk to you about what it does for the section that I looked at. I have used it throughout the last couple weeks, but the section that I wanted to share with you all was hypertension. And so when I looked at hypertension, I kind of looked at it in the sense of if I was really kind of in the clinic and I needed to do something quickly and be able to figure out what I wanted to do with the patient, how I wanted to move forward, how I wanted to treat them, what I was looking for in the sense of being a new nurse practitioner. So for me, for hypertension, I wouldn't necessarily use this clinical practice guidelines for me because I'm not a new practitioner, but if I was, I would look at this and I would consider using it. And so I'm going to go over it with you because each section, as I looked through it, was very similar. So it was a nice flow in each section. So the first section, it pretty much goes through, you know, the description and describing and defining what hypertension is and what to look for. And then it goes into severe hypertension and when you need to transfer them to the ER which is excellent because sometimes we don't, we don't think about it, or we have a chronic patient who's on 3 or 4 meds and we feel like, okay, we're just mismanaging and we want to add something else or increase something. But if it's severe, we may want to send them to the ER for a workup. So it goes into that. And then it goes into other things that would be considered a severe situation with hypertension, like encephalopathy, retinal hemorrhage, acute renal failure, things like that, okay? And then it goes into what your treatment goals should be. It goes into that's pretty much for the severe hypertension, and it goes into previously untreated hypertension. And then the next section, sorry about that. So then the next section, it goes into your initial workup. If you are just seeing this patient, you're finding the hypertension and you're trying to work it up. So it tells you everything you need to do with the initial workup, as far as their past medical history, what their comorbidities are, their social factors, physical exam, what you need to be looking for on your exam. It goes through what tests you need to order. And then it shows you what to look for your secondary hypertension workup, okay? And how to evaluate that and possible causes for that. So I thought that was excellent. And then it moves over into the classifications of hypertension based on JNC 8, as well as ACC and AHA, okay? So it goes into both of those. So there's a table for that, and it tells you how to treat patients who present based on those 2 guidelines that we use in clinical practice. So I found that nice. It also went into a table on, a table on a diet, the DASH diet, and what you should be telling your patient based on that. Lifestyle changes, what to encourage your patient to do, even white coat syndrome, what you can do for that. The next portion is what I really liked. They have a table for your medication management. So it goes into your beta blockers, your calcium channel blockers, your central alpha agonist. It goes into your loop diuretics, all of that good stuff. Then it breaks it down from the elderly to ischemic heart. So it really goes into really good detail as far as what to do and in what situations. Okay, so I really did like that. And it also, what I feel is very important, it also goes into if you decide to start an ACE inhibitor, a calcium channel blocker, a loop diuretic, where to start and where it's maximized. So I do like that. Okay, and then the last thing that I want to say about this particular book and this clinical practice guidelines. Now, you guys do know that I have a couple other books that I like a lot, and I will do a video on those in comparison to this one. So look out for that one, because I'm going to compare this one with my SOAP for family medicine and also my clinical practice guidelines that I love for, is it hold on, let me see. Anyway, I think it's Fitzgerald. But anyway, no, it's not. It's Graham and Uphold. Sorry. Yeah, it's Graham and Uphold. So I'm going to do a comparison of that, and I want you to look at that also. So for the clinical practice guidelines book, this particular one that I was asked to review, I think this is a really good one for the new nurse practitioner and student. Really excellent. If you're a student or a new nurse practitioner, this would be a very good guide to carry around with you. So the last thing that I want to highlight or tell you about this particular book that I do like a lot, I do like that there are some sections that have practice pearls. where they pull out some things that you really should remember. So the practice pearls that they talk about for hypertension are, it tells you, hey, follow up in 1 to 2 months, you know, just to, you know, see what their status is and if they're reaching their goals. If they're not reaching their goals, you can adjust. It says, don't give an ACE and an ARB simultaneously. Of course, you know that, but it's something to remember. It's a pearl. Also, recheck your basic chemistry profile 2 to 3 weeks after starting an ACE. So it goes into that. Look at your creatinine, you know, on the patient. If it's elevated to a certain extent, to stop your ACE. When the patient is when the patient is on more than one hypertensive medications, what to do. It tells you that. It talks about NSAIDs may interfere with the effect of an ACE inhibitor, a beta blocker, or a diuretic. So these are really great. Sorry about that. So these practice pearls, I found them to be really good. And honestly, if you did not have time to go through the whole section, like word for word, it may be beneficial to run to the clinical practice pearls section of this book and know that section. Because if you're a student and you're about to test for your boards, this section is critical, right? So if I say anything about this book, I really like the practice pearls section because I think it's really valuable for a new nurse practitioner and a student who is about to test for their certification. So guys, if you like this content, go on and smash the like button, subscribe to my channel, and if you want more of this particular content, then let me know, and I will make sure that I continue to give you the content that you're looking for, and I'll see you in the next video. Take care, guys. Bye, guys.